Now, the other news that people have focused on lately has to do with notices that some Americans have gotten from their insurance companies suggesting that because of the Affordable Care Act, they may be losing the plan that they bought. Now, while virtually every insurer is offering new, better plans and competing for these folks' business, I realize that can be scary for people if they just get some notice like that. Now, if you have or had one of these plans before the Affordable Care Act came into law, and you really liked that plan, what we said was you could keep it if it hasn't changed since the law was passed. I know that there are millions of Americans who are content with their health care coverage. They like their plan, and most importantly, they value their relationship with their doctor. They trust you. And that means that no matter how we reform health care, we will keep this promise to the American people. If you like your doctor, you will be able to keep your doctor, period. If you like your health care plan, you will be able to keep your health care plan, period. No one will take it away, no matter what.
Well, and he's exactly wrong. He says it's the insurance companies. No, it's the legislation. The legislation says very specifically, if you had your insurance before Obamacare, and if it's never changed, you can keep it. But if you've had it and now it's changed at all, you have to take Obamacare. You get 4 choices, whereas you might have had hundreds of choices before. Under Obamacare, you only get 4 choices, and you're being dumped.
Last week, the number that we had was 93 million Americans will lose the current insurance that they have.
I was going to say, you know what that number probably equals? Everybody with individual insurance or small business insurance. Because if your plan ever changes, it's no longer eligible. And they usually change the plan just a little bit each year. Any kind of change to a plan makes it ineligible, and you have to get Obamacare. So really, when he said you could keep your doctor, it's the opposite. No one's going to keep their doctor. No one with an individual plan will still have it within a few years. And then the question is, when we get the employer mandate, how many of those are going to have to change? If your employer insurance changes from year to year, doesn't meet those 4 plans that Obama thinks you should have, I think this is going to be a disaster. We're talking about 20% of the marketplace. What happens when the 80% that has the employer mandate, what happens when that kicks in and all of those people lose their insurance because it doesn't meet the 4 plans? Yeah. This thing is going to overwhelm the country.